I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. Well, we have a great show for you tonight, and I'm telling you, this is a show that everyone has to listen to because we're talking about planning, advanced planning, and we'll describe what we mean by that in just a few. Well, I'd like to go and talk about my favorite two words. It's called caring and sharing. And what it's all about is that if we care for our bodies, if we care for take care of our medical care, make sure you go to the doctor. Make sure that you take the medications that you're supposed to take. And when you're doing well, guess what? Share it with someone else. You know, if you have a friend that has high blood pressure, then talk about your doctor. He may need a good doctor to go to. Or talk about the medication that you're taking and how it's helping so he can go to the doctor and get medications to help bring his blood pressure down. It's so important that we communicate to each other, that we actually get together and do a little testimony every once in a while and let people know how well you're doing, and they should go to their doctor and possibly they could do just as well as you are. It's important. We should communicate, caring and sharing. Remember, med moments, my big word. That's a word that I love because that tells me that you're actually taking care of your body and you're listening to your body. If you're having chest pain or if you're having knee pain, that's your body actually telling you that something may be wrong. That's a med moment. A med moment is when that body is telling you, hey, check it out. Go to the doctor. Go to the emergency room. Something. Don't ignore it because it could be something serious. So those are 2 points that I just wanted to stress today. All right, we're going to connect with you guys, and we're doing a lot of connection out there. Obey Your Doctor, Facebook. We're doing it on Facebook, Instagram, Twitter. Obey Your Doctor. Just go there. We're doing so much. We're putting up inspirational messages. We're putting up health tips. We're putting up food facts and ways to lose weight. All of this is on there. I want you to go and check out Obey Your Doctor, and you'll see what I mean. And you can check out the website as well. And that has all the TV shows on it. Go check them out. All right? Let's take care of our health. Let's talk. This is my little segment that I'd like to just hit on a little topic today. And today's topic, we're going to talk about check your medicines. And all of us, we have medicines, either from the doctor, or it could be from the health food store, or it could be from anywhere. We have something that we take, either vitamins or supplements. Well, guess what? If you're going to a doctor or if you're going to a pharmacist and you're going somewhere that you have to check yourself as far as medical medicine is concerned, then bring your medicine along with you. Put it in a bag or make a list. It's very important for the physician to know what you're taking, especially if they're meeting you for the first time. All right. So I'm talking about prescribed medications as well as over-the-counter medications. And we're talking about vitamins. We're talking about supplements. We're talking about medications, all types of medications. If you have allergies, definitely tell the pharmacist or the physician that you have allergies and what those allergies are all about. Ask questions about your medications. If a physician gives you a medication, make sure you understand what that medication is for and how it's supposed to what effect you're supposed to get from that medication. That's what I should say. All right? Make sure that the medicine is what the doctor ordered. So when you get to the pharmacy and they give you the medication, make sure the names are appropriate and make sure that how the doctor said to take it is the same as it should be as it is on the bottle. Okay? Ask how to use the medication correctly. So, read the directions. As I said, take it as it should be taken. Okay? Because if you don't, it could be harmful. There could be side effects. All right? And when you're talking to your doctor or the pharmacist and they give you the medications, ask about side effects or what side effects that you should be looking out for. It's very important. All righty? And if you get a side effect from a medication, call your doctor right away. And if any serious side effects, go to the emergency room. These are my tips as far as check your medicine. Alrighty. So we've come to a part of the show where we're going to talk about advanced care planning. All right. And I have the perfect person to talk about this particular topic. Her name is Alicia Selby. All right. And she is a palliative care social worker at Newark Beth Israel Medical Center. Alicia, welcome to our show.
Thank you so much.
All righty. So this is one of those topics that, because I'm a critical care physician,
yes,
I rely on your expertise so much, and that's why it's so important that we explain and we tell people exactly what this is all about, because it's so important at the time of life that you should know everything, and everybody else, or you should know, or somebody else should know. Sometimes they don't know.
That's true.
All righty. So let's step back just for a second. Tell me exactly, what is advanced care planning? Okay.
So advanced care planning is a process that people can use to help plan their care in the event that they are dealt with a serious crisis, health crisis,
right,
and are not able to communicate with themselves.
Oh, all right.
It's a way that they can put their care wishes in line with their values for future care going forward.
Now, is this difficult to do? Do you have to, you know what I mean, are there millions and millions of papers to fill out, or what do you have to do to put all this together? I mean, it sounds complicated because it's a serious issue.
It is, and you should put much thought to it, but I think there are 5 easy steps to address it.
Okay.
The first thing is to think about it, to think about what your wishes are.
Right.
Think about your values. Think about what's important to you. Think about what your quality of life means to you.
Oh.
The second one would be to talk about it. Talk it over with your family members, your friends, and of course your physicians.
Right.
Then put it in writing. So that's where some of the writing comes in. There's several different types of legal forms that you can document your wishes on.
Okay.
Advance directives, healthcare proxies, posts, and we can talk more about those things. But definitely put your wishes in writing.
Right.
The next thing would be to share it. It's not only do you think about it, you talk about it, you have to share it with people.
Right.
After that document is completed, share it with your loved ones so they can know what your wishes are. Give a copy to your physician. The same way you take those medications each time, you should be taking your advance directive or your medical wishes with you.
Right.
Also, you should update it, review it. You know, we all change, values change over time, your preferences change, so it should be updated periodically and at least annually.
Right.
So those are some things. You start off the process. Think about it, talk about it, write about it, share it, and review it.
I got you. Boy, that's quite a rendition there. Now, what I want to ask, once you put all this together,
yes,
can you change your mind?
You can. You can change your mind at any time.
Anytime.
Anytime.
So how do you change your mind? You just say, hey, I don't want that anymore. You know, you know what I mean? Do you have to get a legal document or something to say, no, I don't? You understand what I'm saying?
Well, if you have put your thoughts or your wishes in writing, the best thing to do is void it. You can always shred it, rip it, void it, put a line through it, and you can create a new document. Or if you wish not to do that, just make sure that your family, close friends, and physicians know that you have changed your mind, you have made some additions or some limitations to what your wishes are, and you can change your mind at any time. At any time. Anytime.
Now, you working in the hospital, I know that a lot of times you connect with people once the illness is there.
Yes.
A lot of times, and then they have to make up their mind at that point.
Yes.
What they want, and you know, is it more difficult? Do you find that it's more difficult for the patient who is sick to try to make that decision? And so, and what I'm trying to say is that how important is it to make it prior to the illness?
Well, I think it's very important because at the time when you're entering the hospital or you're a patient in the hospital, chances are there's a crisis going on.
Right.
There's a crisis situation, and it's difficult to make those type of decisions when you're in crisis. So I think that families should talk about it beforehand, which lies a problem. Most families don't talk about those things. I hear a lot of stories of people saying, well, I tried to have that conversation with my spouse, with my children, but they didn't want to talk about it. It's very important. If you can have that conversation about what your wishes are, have it with your physician. Patients trust their physicians, which they should, to have those difficult conversations.
Right. It's interesting because I find that families that have the advanced planning already prepared for them and it's there, things go so much easier during a critical you know, a critical illness when a family member, when that happens to a family member, it seems to go so much easier.
I would agree. It's difficult at any time to be in a crisis situation and have your loved one there very ill.
Right.
But as you said, if a document is in place, it will help guide the care. It also helps to refresh the minds of family members to say, I know that he or she had said to me they wanted this type of treatment or this type of care.
Right.
And it helps ease the stress at that time.
Okay.
In a very difficult situation.
It's difficult. Talk about it. Alrighty. Do you find that when, and I'm speaking of my experience as an African American male, and you know, church is a big issue and a big stabilizing factor in our lives and in our culture. Yeah. Do you find that when if it's hard to talk about it, if you pull clergy in to help with that it's better in that realm? I
do. And every patient that I see, I always ask, do you have a religious a religion that's important to you or spirituality?
Right.
We often will invite a family or patient to bring in their own support,
right.
But we also at Newark Beth Israel have chaplains. And a lot of times before we can address what's going on medically with a person, we have to address what's going on spiritually.
Right.
And that spirituality and religion does help guide decision making.
Right, right.
And what type of treatment or care preferences a patient has.
Right. I understand. Putting it in writing. Okay, let's just step back for a second here. I know there are a lot of people that just don't write well.
Okay.
Me. You know what I mean? But you understand what I'm saying. They need help. They would need support in putting something in writing. Do you have to like write paragraphs of what you... Tell me about this process of putting it in writing.
I think the first thing, after you've thought about it, just pick up any type of piece of paper, any pen, pencil, crayon, and just jot down what your thoughts are about your health care.
Right. It doesn't have to be in fancy sentence structure and all of that
and
kind
all
of stuff.
That, no.
Right.
But there are several different documents that people can obtain for free. They can pick them up from hospitals, internet, that will help guide you through certain questions and how to answer those questions. It also will give you definitions and explanations about what type of care is available during a crisis time or during a serious illness.
Right. What if there's a family member that's assisting, an older family member, filling out forms or putting their wishes down? Do you find that there's that sometimes those family members want to impose their opinions on what is ultimately coming down on the paper?
Yes.
Do you find that sometimes?
We find it quite often. I'll give you an example of one. Say you have an elderly woman who has 5 children.
Right.
Who have never written her wishes down. But each child comes from a different premise because they have a different relationship with mom. And they may have had different conversations with mom. But they all may come to the table and say, well, while we were shopping, she shared this with me. Or when we were at home cooking, she shared that with me. So the opinions can be different. And that's why it's important that when you're having these conversations, and if you didn't write it down, make sure that all the siblings know. Make sure that all the children know. Make sure your spouse knows that. So everyone is on one accord with your wishes.
Okay. All righty. And reviewing it. You say at least once a year to review it?
We would say do it more often, periodically. Things change, illnesses change, values change.
Right.
So you should be taking a look at it to see, well, you know, I thought I would want a certain type of treatment this month, but, you know, now I've been diagnosed with an illness, and I think my thoughts about that may have changed. So you can change it then, but definitely annually. And you don't have to redo the whole document. You can just put an update it and sign